to tell me we're going, or I hear you introduce me.
Good evening, sir.
Hello, Sumit. Good evening. Dr. Sumit Singh is an executive member of Indian Academy of Neurology, and he also did activities today during the day. He's in Gurgaon, Delhi.
Well, in case I don't get to speak to everybody, Chandrasekhar, if you could afterwards thank them all on my behalf if you see them for their efforts today and through the week.
Yeah, sure. For 4 years as a president, it must be quite a bit of work, and you did a lot of work during your presidency tenure. I think it's almost a full-time activity, looks like.
It is actually. It is a lot of work, but it's all relative, I think, and everybody who commits their time to these sorts of activities puts in their full effort. So I'm very much indebted to all who have done that, because without everybody working together, we don't achieve much.
Yeah.
But since my term was completed, I do have a little more time. So it's been an enjoyable time this last 6 months.
Hello, everyone.
Hello, Steve.
Hi, Steve.
Good morning.
Hi, Bill. Hi, Chandrasekhar. Good morning or evening. Can you hear me okay?
Yeah, you're a bit metallic, but clear.
Sorry, I think this is better than not wearing it. Actually, I'll try it now. Hold on 1 second here.
How does this sound? Okay.
Oh, perfect. Yeah, much better.
Okay, great. I'll keep it off then. Thank you.
I'm just waiting for the IAN president to join. Yeah, good evening, Nirmal.
Good evening. Sorry, I couldn't locate the link. Sorry.
Okay, we'll wait for about 2-3 minutes and then we'll start.
The WFNR webinar just got over.
Okay. So this program is on Zoom, YouTube, and Facebook, going on simultaneously.
Excellent.
How is the COVID situation now in Australia? Is fine?
No, it is good. But we have quite a number of cases now, and it's rising with the second Omicron variant arriving. But the degree of illness severity and certainly the mortality is much less.
Yeah,
given that
I think same situation here.
Yes.
Yeah, in between, in India, we had almost less than 1,000 cases. Now it is about 20,000 plus.
Cases?
Yes.
Yeah, so yeah, I'm not sure exactly what our numbers are, but ours would be easily at that level in new cases. But it's I suspect there is a degree of lessening of people who are reporting themselves with a positive test. So it's hard to know. The most important measure for us is the utilization of intensive care unit beds and general beds for COVID-19 cases, and that's not rising. Do you have antiviral medications available as well?
Yeah, they are available, but I don't know how much benefit they have.
It's hard to gauge. I agree. We haven't seen. There's been no trials, as I understand it, with looking at efficacy and outcomes in a vaccinated population. Several of us are urging that to be done in Australia because we have a very high rate of vaccination in the community. So it would be a perfect opportunity, but we don't have that data as yet either.
Nirmal, I think we should start because this.
I think so. Then people can join in on.
Yeah. So should we start?
Sure.
Yes, please.
Good evening, good afternoon, and good morning. I am Dr. Chandrasekhar Mishra, co-opted trustee of World Federation of Neurology and chief coordinator of public education activities of Indian Academy of Neurology. I welcome you all on behalf of World Federation of Neurology and Indian Academy of Neurology and extend warm greetings on occasion of World Brain Day. The Indian Academy of Neurology has been very active in conducting the public education programs throughout the year. Like on 30th January, we conducted a session on neglected tropical diseases, 9th February, International Epilepsy Day, 24th March, World Tuberculosis Day, 26th March, Purple Day, 2nd April, World Autism Awareness Day, 11th April, World Parkinson's Day, 30th May, World Multiple Sclerosis Day, and 5th June, World Environment Day. Though this awareness we wish to improve patient care through early diagnosis and treatment. And this has been our observation that awareness program really helps the patients. The theme this year is brain health for all. And it is such an important topic that we decided to extend the campaign for 1 week and to do at least 100 activities throughout the country. For this session, we have Galaxy of Stars, and I would like to welcome Professor Wolfgang Griswold, who is the president of World Federation of Neurology. He's from Austria. He was former Secretary General of WFN, and he has a lot of interest like neuromuscular, neuro-oncology, palliative care, advocacy, education, and history of neurology. I would also like to welcome Professor William Carroll, who is a former president of World Federation of Neurology. He's a professor of neurology at University of Western Australia. And he has tons of papers. His main area of interest is multiple sclerosis. And he was awarded the Western Australian of the Year award in 2012. And subsequently, he had many more awards. And commitment for the activities of World Federation of Neurology. I would also like to welcome Steve Lewis, who is second-time trustee of World Federation of Neurology and currently acting Secretary General of WFN. He's from Pennsylvania. He authored 2 books, and he's editor of World Neurology, chair of teaching course committee of the World Congress of Neurology in Dubai and Rome, and he's editor-in-chief of the famous Continuum by American Academy of Neurology. And 2009, he received A.B. Baker Award and Lifetime Achievement Award. I welcome Professor Thisa Vijayarapni. Thisa is originally from Sri Lanka, but presently he's in Victoria, Australia as Director, Department of Neurology and Stroke Services. He's a co-chair of World Brain Day, and he's Editor-in-Chief of Neurology International MDPI. He trained many students, and he is the founder and chair of Lance Worsby Symposium. And he, at this young age, he already received 12 international awards. I would also like to welcome Professor David Dockick, who is the co-chair of the World Brain Day with Dr. Thisa Vijayarapni. And he's professor of neurology at Mayo Clinic College of Medicine and Arizona. And Dr. David has authored more than 350 papers. He's a past president of International Headache Society and past editor-in-chief of Cephalalgia. I would also like to welcome the very dynamic and enthusiastic president of Indian Academy of Neurology, Dr. Nirmal Surya. He's a consultant neurologist at Bombay Hospital, Mumbai. He's a great leader and motivator And because of his motivation, I think the number of public education activities this year are in multiples. I would also like to welcome Meenakshi Sundaram, who is Secretary of Indian Academy of Neurology, Dr. Sumit Singh, he is a EC member and he is Director of Artemis Institute of Medical Sciences, Gurgaon, Delhi. Dr. Joy Desai is Head of Neurology at Jaslok Hospital, Mumbai. And Dr. Surya Narayan Sharma is a Consultant Neurologist, Apollo Hospital, Bangalore. I would like to also mention the future sessions, and we will have Galaxy of International and National Faculty. On tomorrow, we will have Dr. Catherine Seher, Mental and Brain Health Unit Specialist in WHO. On 24th, we'll have a session. Tomorrow, we have a session on substance abuse and brain health. On 24th, we have a session on loss of vision and vertigo. On 25th July, loss of consciousness, and we'll have Dr. Marco Medina and other specialists. On 26th, neuromuscular disease session. For that, Vexi Laszlo from Hungary and Roysuke Takahashi from Japan will join. On 27th, bladder and bowel involvement and spondylosis. On 28th, a session on dementia, where Riyadh and Augustina will join, and we'll have more international faculties to join. I would like to thank print and electronic media, All India Radio, and all the IAN members for active participation in this event. And now I request IAN President Dr. Nirmal Surya for his welcome address. Dr. Nirmal Surya.
Thank you, Dr. Chandrasekhar Mesham, for your untiring effort for last many years to create an awareness for the public, particularly for the people who are layperson and wanting to hear about the neurological disorder. We have today the galaxy of people, and I must thank them all, Professor Wolfgang, Professor William Carroll, David Roddick, Tisha, Stephen Lewis, and others, with my colleagues of EC members. When I took over as president, it was always in my mind that we need to get support from the society, and we need to reach to them. We need to give them a feeling that we care for you. And Indian Academy is a platform where we are able to reach to them through various days, through various programs. I must thank all the members, more than 100, who came out. And today, the number of programs which I have addressed since morning has been enormous. And there has been a new wave of enthusiasm in the younger as well as senior neurologists in this country to create an awareness. Because when I said 1 week, 100 program, and I'm sure President WFN sir, that we will give you more than that. I already am seeing that we had 140 doctors giving messages which are going on our social media. We have programs lined up which are many. There are different different community. People are going to the schools, colleges. Dr. Sumit Singh has addressed more than 5 schools today morning on the brain health. And not only that, all the big institutes, whether it is PGI or Neiman's or AIMS, they are doing their program to create an awareness on the brain health. I think a movement by the World Federation of Neurology is really going, and I'm sure Indian effort will be infectious to many other countries. And we may see in future much more enthusiasm to create awareness about the various disorders among the society. And I take this opportunity to thank you all to give us an opportunity, and we'll revert to you at the end of the week. And I sincerely request you all, if you have time on every day for a few minutes, please join us, encourage us, and give us the messages to the society that yes, the whole world is with India to create an awareness. As you know that India may be in another few years becoming one of the country with the highest number of population. So we need to really reassure that brain health been taken care, and everybody who is young, his brain is healthy. Thank you once again, and I welcome you all. Thank you, Chandrasekhar Mishra.
Yeah, thank you, Dr. Renwal Surya. And now I would like to request WFN President, Professor Griswold, to inaugurate this session and give his inaugural address. Professor Wolfgang Griswold.
Thank you. Thank you. Thank you, Mishram. I'm sorry I was a little bit delayed by the other webinar. Thank you all, and welcome to this webinar. And I think it's a great pleasure that you organized this World Brain Day webinar. And already I had some kind of taste yesterday how active the Indian society is and how many diverse opportunities to do and you use to promote brain health, not only in science, but also in patient issues. And I congratulate you for that. And I will definitely look into this more closely. As you know, this World Brain Day reminds us of the foundation of the World Federation that was in 1957. If you read Professor Ali's book, many things have changed since, not only neurology, and we are a developing society that is taking on the new challenges that appear. The previous World Brain Days were an invention of Professor Vasai from Pakistan, who actually had the idea, and the delegates took it up immediately. And since 2014, we're doing this. And we've been doing it with specialist societies, mostly like stroke, epilepsy, movement, MS, headache. And this year's World Brain Day is the first one where we took, first of all, an overarching topic, which was very timely, brain health. And secondly, also we choose as parts of the organization committee, the regions. And I can see here in the Asian region how fruitful that is, because I think the stream of this activity goes to many countries, and that's very important. The initial series on world brain health was initiated by Professor Carroll, whom I see on the screen, whom I worked with for almost a year to get a series of videos, but they were always prophetic because they really set the impulse. And since that, several associations and organizations have taken that on. Now, the question remains, what is brain health? And please don't ask me, I don't know. There is short explanations like the explanation from our previous president, Hashinsky, who stated a state of complete physical, mental, and social well-being through the continuous development of exercise in the brain. This is rather short. The WHO explanation is rather long. I will not, you can look it up on the internet. So we don't know exactly. But what I think is important that the WHO follows brain health in a rather holistic approach. And if you will see their paper, which they have published in our journal, in the Journal of Neurologic Sciences about brain health, you will see in what way they do this. And I think that's important for us too, because it's not only neurology. There are many other fields, many other interests, and also patients that we have to take on. It's also the question, is brain health, healthy brain, mental health, related, unrelated? And I think we do believe there's a strong relationship between many branches, and this stimulative way to look at this helps us. I'll not speak a lot about IGAP because I think Professor Carroll will speak about that, but the IGAP is one of the momentum that has been created over the years by the World Federation, by the ILE, by the WHO, by several other stakeholders. And this IGAP, or Intersectoral Global Action Plan, is a momentum for neurology that's unprecedented and should put people with brain disease
Yeah, I think Professor Wolfgang, there's some problem with his connection.
Oh, I'm here now. I think. Can you hear me?
Yeah. So
Sorry, the whole thing dropped out. Actually.
I would request Professor William Carroll, who is a former president of World Federation of Neurology, to speak on the occasion of World Brain Day. Professor William Carroll.
Thanks very much, Chandrasekhar. It's my privilege and pleasure to speak to you all on this topic on the occasion of the 2022 World Brain Day. It is an annual celebration of the founding of the WFN, as Professor Griswold just mentioned, and also the promotion of a topic fundamental to the World Federation of Neurology. Before I start, let me also thank the Indian Academy of Neurology for this opportunity and acknowledge the great efforts being made throughout the year by the Indian Academy of Neurology in neurology education and in support of the World Federation of Neurology. This is not a long address, but I would like to focus on 3 points. First of all, and these are a brief focus also, but first of all is the importance of brain health. Second, where brain health fits in the global perspective of health. And thirdly, the pivotal position of the WFN at present in the promotion of brain health. To take the first topic, I have the next slide, please.
Yeah, Mansi, show the slides.
So the next one, this one here, thanks. So neurological disorders are the leading cause of disability and the second leading cause of death worldwide. This slide highlights that statement from the 2016 Global Burden of Neurological Disease study published in the Lancet Neurology. And it's worth noting that the main contributors to this neurological disability from this study were stroke at 42%, migraine at 16%, dementia at 10%, and meningitis. It's also true to say that inequities of impact and access to resources accentuate the burden, particularly among susceptible populations, including the poor, the disadvantaged, women, and children. The second point is where brain health fits in the perspective of global health. Dr. Griswold mentioned the definitions of health and brain health, but it's worth saying that World Health Organization definition of health in general is that it is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. What is important, as he alluded to, is that the brain is arguably the most fundamentally important organ in the body. Not only is it responsible for our every thought, action, emotion, and creativity, it can also curb violence, express compassion, compose prose, poetry, music, and art, and be trained in athleticism, dance, reason, and thought. It's been said somewhat tritely that there is no health without brain health, but it's true, and it is essential to our very humanity. The brain needs to be nurtured and cared for and educated to serve us lifelong. It's a precious organ. The important corollary here is to avoid brain injury. I'd like to digress just a little now. I've used the term brain health, but you know I'm referring to neurological health. Neurological health is a term we all know, neurologists all know, but to many people, it's a strange and almost unknown concept. What is a neurology? What is neurological? Brain health, the term, provides a means to improve the communication about neurological health. Almost everyone knows what a brain is in any language, and it's a short step from there to neurological health. And you may think that this is overstating the problem about the opacification of neurological health. But I'll just illustrate this, and fortunately it's changing. Until recently, neurological disorders within the World Health Organization were camouflaged so well in mental disorders and substance abuse that they were almost invisible. Indeed, the recent Intersectoral Global Action Plan for Epilepsy and Other Neurological Disorders, or IGAP, adopted by the World Health Organization at the 75th World Health Assembly in May of this year, was the first official recognition of neurological disorders. Happily, there is now a brain health unit in the Department of Mental Health and Substance Abuse, headed by Dr. Tarun Dua, who is the focal point for all neurological matters within the World Health Organization and who spoke in the preceding World Brain Day webinar today. The WFN, the World Federation of Neurology, together with a number of members of the Global Neurological Alliance, notably the International League Against Epilepsy, the World Stroke Organization, the International Headache Society, the International Parkinson's Disease and Movement Disorders Society, contributed appreciably to the development of the World Health Organization IGAP. The IGAP, or Intersectoral Global Action Plan for Epilepsy and Other Neurological Disorders, not only recognizes neurological disorders, but acknowledges the lifelong burden from injury or illness of the brain and the need for disease prevention. Importantly, the IGAP sets out the responsibility that the WHO member states have in ensuring that their populations have appropriate resources and interventions to prevent and care for neurological illness. I cannot overstate how important IGAP is in the struggle to deal with the burden of neurological diseases and illnesses, particularly in low and low middle income countries. Turning finally to the position of the World Federation of Neurology, this current World Brain Day campaign aligns with the World Federation of Neurology mission to foster quality neurology and brain health worldwide. It comes at a time when the world has recognized the importance of brain health initiatives developed or developing by the United Nations, the EU, the European Union, the National Institutes of Health, and the World Federation of Neurology, amongst a groundswell of interest in brain disease and health. I won't go into the details and the amounts of money and effort that have been used by these various global organizations, but they are considerable. However, equally important to these initiatives, if you like, at the top, is the education of all people of the world on the paramount importance of brain health. Large swathes of the global population remain relatively uninformed of the importance of brain health and the prevention of brain disease. Once understood, then, even those in under-resourced areas and within under-resourced populations can advocate for access to factors essential for brain health for themselves and their children. Simply put, clean water, nourishing food, and adequate energy lead to a rise in education levels and a willingness and ability to achieve the appropriate reallocation of health resources. In this regard, as Professor Griswold mentioned earlier, the World Federation of Neurology launched its own brain health initiative directed specifically to those where the need is greatest. This present World Brain Day topic, Brain Health for All, expands on this theme and joins a number of other initiatives that are growing around the world. Now, knowing where the inequities of access to the resources for neurological care are most in need is aligned closely to the global promotion of brain health. The World Federation of Neurology's Needs Registry is a serious attempt to obtain an accurate picture of those needs. Carefully compiled with the active participation of 117 of the 123 member societies, and the vital assistance of the World Federation of Neurology London office, the Needs Registry data represents a unique and valuable resource of the global situation made by those involved directly in neurological care. It provides information for the availability and accessibility of neurological services, the availability and accessibility of therapeutics for common neurological conditions, the challenges facing neurologists in the practice of neurology, and additionally, neurologists from each member society listed their 3 most urgent neurological needs. I have the next slide, please. This should be a bar graph. It'll be 2 slides on. This should be a bar graph illustrating the range and depth of information. And it shows the distribution of the accessibility or the availability, or indeed the non-accessibility or availability of each of 14 services. You'll see that on the right-hand side, the yellow bars are higher, taller than on the left side. This is where EEG and epilepsy services are not available. Whereas on the left-hand side, you can see that they are mainly available. And those countries that are there represent those with better resources than those on the right. When it came to the 3 most urgent needs listed by the different member societies, there were some 300 items which provided an informative range of requirements. These distilled to about 50 separate individual items, as many requirements were common to all member societies. Of these, the most frequent were more neurologists, more resources generally and regionally, and specialty centres, particularly for stroke, epilepsy, and dementia. I have the next slide. I think this is my penultimate slide. And this shows the drivers for, as I see it, for brain health and the important position that the WFN occupies. Can I have the last slide, which just changes this a little bit and demonstrates the importance of working together with the World Health Organization and its member states, that is governments, and for the WFN and other like global organizations working with people who are actually in the position of providing the health care and advice on how to avoid brain disease or prevent it. What it illustrates is that there is a top-down and a bottom-up for all of these organizations, for the WHO, for the WFN, and all the other members of the Global Neurology Alliance and other international organizations. What it means is that we must all work together and we must advocate for the reallocations of resources such that there is no inequity of access and that there is no inadvertent injury or loss of function of brain, particularly brain function, because of inadequate resources. I'd like to thank you all for your attention and hope that this message can be echoed around your areas, your towns, and your countries. Thank you.
Yeah, thank you, Professor William Carroll. I think very important message, and we are happy that WHO is taking a very active step, and through IGAP, now they are going to focus on brain health. That's a very welcome development. Thank you very much. Professor Griswold, we had disconnected in between.
I had disconnected. Yeah, I had disconnected. Sorry, I heard the speech from Dr. Carroll, and I think I have nothing to add at this stage. Again, congratulations to your efforts, and let's all work together on the IGAP, and not forget policy, therapy, prevention, innovation and research, and public health. And I think with that, we are armed to use this momentum. And the next essential meeting with the WHO will be in August, where the WHO will be asking all stakeholders, and it's not only the WFN, but many others, to advise on how to implement. And this implementation implementation, as has been said before, should take about 10 years and should be in stepwise progressions with back reporting. And that is really a momentum and a chance that neurology will have to use. And with that, thank you again. And I apologize for myself being cut out. Thank you, Misha.
Yeah, thank you, Professor Giswold, for your words of advice and being with us. I think it is all technology. We are living in the world of technology, and sometimes we can have problem with the technology. I would like to also welcome Kimberly has joined the session. Welcome. Now I request Professor Tisa Vijayarapni, who is co-chair of World Brain Day, for his words of wisdom and address. Tisa.
A very good evening to all of you, morning and afternoon for some of you. Having just had a really fabulous webinar, I can't stop going back on memory lane. I think if I remember correctly, this happened in Marrakesh, 2011. Myself, Wolfgang, and someone else was there. I can't remember. She was a lady, and we were just having a cup of coffee. And we were talking, every other disorder has a day. How come we are advocating for brain health? How come we don't have a day? So this went on to 2 or 3 cups of coffee, and in the evening we were having a chat with Professor Vladimir Hachinsky. You know the rest. In 2014, few years down the track, then the Public Awareness and Advocacy Committee Chair, Mohammed Vase, made a proposal, as we planned over the preceding years, to introduce a World Brain Day. And since then, first year we talked about brain health, then stroke, epilepsy, clean air for brain health, the aging brain, migraine, stop the multiple sclerosis, Parkinson's disease, and this year is almost like a pinnacle, basically promoting brain health for all. This audience doesn't need any convincing stories you heard from our current president and former president, very powerful messages. Why should we care about it? You have seen this, Steve kindly published earlier in the year of a summary of what we have been up to thus far. Again, you already know why brain health for all, so I wouldn't bore you with this, as Bill absolutely correctly, in a pristine way, pointed out. We are absolutely nothing without our brains. We do all good, bad, ugly, clever, fabulous things out of our brain. Without our brains, we are zero. I would also like to point out that the Asia-Oceania is home for 4.72 billion people, and Africa is home for 1.3 billion people. Sadly, the burden of neurological disorders impact where the life is most tough for that part. But as you all know, I practice the brain health in Melbourne, Australia, which was nominated as the most livable city in the world, beating our president's city a few years back. And we also suffer from all those key burning issues here too. Access, awareness. I remember doing a survey a few years back. My hospital is close to Melbourne metropolitan city, only 6 kilometers away from the central business district. Only 14% of my patients knew that stroke is a brain disorder. Only 15.6% patients came to hospital within 3 hours. So we got a problem, just like everyone else. We are in this together, whether black or white, brown, or whichever the language that you talk, whichever the place that you stay, we all deal with these problems. So it is time to action now. Again, we know that the brain disorders are the leading cause of disability, second leading cause of death. Among the close to 50 participants in this webinar, including faculty, large number of us are having a brain disorder as of now, knowingly or unknowingly. So at least for the selfish reason, we must care about brain health for all now, not tomorrow. You saw these numbers before. this is how 1 in 3 of us having a brain disorder. As you can see, the point that I would like to remind you is nearly 90% of the strokes, nearly 40% of dementia, nearly 30% of epilepsy can be prevented. Both David and me know very well, and everyone else know also, headache disorders. We have absolutely excellent preventative pharmacological, non-pharmacological, prescription, non-prescription interventions that could make their life heaps better. But many of those patients wouldn't even hear about them. So we got a problem. This is the WHO definition of brain health that our president, Professor Griswold, was talking about. Brain health as the state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize the full potential over the life course. It's incomparable with what Professor Carroll mentioned as definition of health from 1987, and what Professor Hachinsky was proposing in Lancet Neurology early this year also. Physical health, healthy environment, safety, security, learning and social connections, even like this, access to good services at the individual level and as well as at the societal level is critically important for lifelong adaptation of good structure and function of brain if we were to, let's see, continue humanity worldwide. Optimizing brain health is key for physical and mental health that also create hugely positive social and economic impacts, all of which contributes to better well-being and better progress and growth for us as a human society, irrespective whether we are ill with brain disorders or not ill with brain disorders. The brain health is vital. This is from our slide set that you can download freely from our toolbox. Is vital for mental, social, and physical well-being. And there are 10, 15 things that we can easily adopt to keep our brains healthy. But remember, even the audience here, if we ask, if we tap our heart and closely ask, are we doing all those things? I'm sure we all have room for improvement. So we must do that now. So it is timely that this World Brain Day, which I would like to see as a beginning of pulling entire world together in collaboration or in partnership or in association with the WHO Intersectoral Global Action Plan to promote, I would like to say as 5 fingers, awareness, prevention, advocacy, education, access, if we were to continue to maintain humanity in this planet for more than a couple of generations ahead. It is time to act now. It is now or never. This is action time. This World Brain Day is in a way unique. We are implanting a seed among global neurology community and global neurology patient community, which is few billions, as you have seen. It's time for all of us to get together, rally around World Federation Neurology, World Health Organization, and every other organizations, including our partners, other associations that we have been working with year after year after year for successive World Brain Day campaigns to promote brain health globally, and also to make sure that we nail this global action plan much bigger and better than what is anticipated in the coming years. So get involved. Please visit our website. Please Google World Neurology and read regularly and download them, share them, translate them into your language, talk to your patients, talk to your members of parliament, talk to your press. You all are very good at doing this, but do more and bring the other 52 nations in Asia, Oceania with you. You are the big brother for many of these countries in sort of a good heart. I am saying this. And I should advertise a little bit on something that is close to my heart. We are bringing the Asian Regional Congress of Headache Disorders as a virtual event with some help from International Headache Society it's a virtual event. We got 53 speeches ready to row, and it's 100% free. Already 220 people registered since we opened that up. Just type www.arch22.net. As headache disorders, as Professor Carroll pointed out, is responsible for almost 17% of disability. And what better way to deal with that immediately, beginning the new beginning with the World Brain Day campaign 2022. Let's combat headache disorders and make them thing of the past and cut back that almost 17% disability very close to zero. So join us today, spread the word globally. And with that, I wish you all the very, very, very best for a fabulous, fantastic World Brain Day and excellent brain health, so that you can enjoy this massive 100+ World Brain Day campaign, creating a world record. And again, thank you so much for having me in your beautiful nation virtually, and looking forward to see many of you at the next Asia Oceania meeting, face to face, hopefully. And congratulations for such a successful, wonderful World Brain Day campaign. And I would log in as I did throughout the day as much as I can to support you emotionally and wholeheartedly, as it is now or never. This is action time. Next 10 years are the brain decade, and we must get this job done now. Thank you.
Thank you, Professor Tissa, for the wonderful address. And I think it is very important that we'll need a focused activity for low and middle income countries in the coming years, because these are the regions where we have a lot of problems about the education, training, facilities, finances, and so many things. And once we talk about lack of educations, I think I would like to now invite Professor Steve Lewis to talk about neurology education, brain health, and WFN. Steve. Tissa, you mentioned about 50 participants, but the program is live on YouTube, and there are many more on YouTube as well as Facebook. So it's going on simultaneously at 3 places. Thank you.
Sorry, I was muted there for a minute. I want to thank you, Professor Meshram and Professor Surya and all the rest of the organizers and the Indian Academy of Neurology for really celebrating World Brain Day today and inviting me to be one of the speakers. So I'm going to speak today briefly about brain health, neurologic education, and the role of the World Federation of Neurology. As you know, as we all know, it's dedicated to brain health for all and optimizing brain health and reduce the global burden of neurological disorders. One of the 5 pillars, as we all know, is education. I'm going to talk about education. Education is the key, really the key to brain health for all. Now, public education will improve brain health and reduce the global burden of neurological disorders, and particularly education on healthy diet, sleep, physical activity, and really the importance of knowledge by the public of the role of risk factors in neurologic disease. But I'm going to talk a little bit about what the WFN and other organizations are doing to improve brain health from the standpoint of education of neurological providers. And this slide from the WHO Atlas of Neurological Diseases, published in 2017, that the World Federation was heavily involved in. You can see on the left-hand picture, the median neurological workforce. That's the number of neurologists per 100,000 population. In Africa, it's as low as 0.1 neurologists per 100,000 population, and in many countries, 0 neurologists, and it goes as high as 9 neurologists per 100,000 in Europe, and in between for all other regions of the world. Looking at the right-hand picture, you can see the median neurological workforce per 100,000 population by income group, and in low-income countries, as low as 0.1 neurologists per 100,000, and in high-income countries as high as 7.1. So there's a great inequity of neurologic access, and one of our roles in the World Federation and really in all organizations of neurology is to try to improve that global neurological workforce. Specifically, the mission of the WFN is to foster quality neurology and brain health worldwide, a goal we seek to achieve by promoting global neurological education and training with the emphasis placed firmly on under-resourced populations in the world. I'm going to talk briefly about some of these educational activities. One of our primary activities in the World Federation is through the WFN Training Centers. We have 5 training centers worldwide right now, providing a high-level neurologic education to neurologists who otherwise would not be able to participate in such education. In most of these centers, we have both a 4-year training to receive all of their neurologic training, as well as a 1-year fellowship as well. And we have in Morocco, Cairo, Senegal, South Africa, and Mexico for English speakers, Spanish speakers, and French speakers. And we are actively considering a training center in Asia as well. And I think there's no better place, frankly, than India to provide that kind of training. Here is a picture of one of our trainees from Rwanda who participated in the Senegal Training Center under the auspices of the World Federation of Neurology. Again, training she would not, full training, she would not have been able to perform without this activity. As I mentioned, in addition to full training, we're providing fellowship training, which also really would not be able to be obtained without this program. Here's some pictures of some trainees in Morocco who received high-level training in a subspecialty of neurology called clinical neurophysiology. And here's another picture of a trainee from Rabat who also received clinical neurophysiology training. In addition, we have what we call department visits, sponsored by the World Federation of Neurology and by the local regions as well, and the national societies. And I'm going to leave some out, but these are from throughout the world, which have included Turkey, Austria, Germany, Norway, Canada, and others. And I'm pleased to say that soon we'll be having an Indian training center under with the help of Dr. Meshram, and a Spanish training center. And these will be very, very important 4-week observerships from participants from lower income countries who would otherwise not be able to learn about the most up-to-date neurological care and kinds of diagnostic procedures that are not available in their local country. In addition, we have junior traveling fellowships. These are for actual trainees in other countries, particularly low and lower middle income countries, who are given $1,000 US dollars per awardee to present their research at national and international conferences. But really, more importantly, they're able to participate in these conferences and learn from the experts throughout the world. One of our other important activities in training neurologists worldwide is through the IAN's publication Continuum, Dr. Meshram talked about earlier. And Continuum is a continuing medical education publication, and through the American Academy of Neurology and its publisher, Wolters Kluwer, 400 hard copies are donated each issue and provided free of charge, as well as online, to participants from low and lower middle income countries to utilize this as a resource for ongoing education, continuing education, and as a point of care resource. You see pictures here of participants receiving diplomas after their activities. And I'm pleased to say I participated in this past year in a virtual continuing program through the Indian Academy of Neurology, and it really was just a terrific program, and really an important source of education for neurologists in India and throughout the world. I think I'm frozen here. There we go. In addition, we have WFN Educational Grants. These are grants up to $100,000 per year. Typically, about 6 grants are provided per year for the maximum spend of about $100,000. And one of the important elements of these grants is many are on neurologic education of the public, education of neurologists, as well as about diseases. And this is a very important part of our educational efforts in the World Federation. The World Congress of Neurology occurs every other year, and a very important part of that as well is education. We also have a patient education day, but also the primary aspect, of course, is education of neurologists and other physicians about what's going on in the world of neurology and diagnosis. So a very important part of education of the neurological workforce. The e-learning hub is a relatively new aspect of the World Federation of Neurology's, sorry, I'm going forward there, the World Federation of Neurology's educational activities, providing free resources throughout the world. And we'll talk about what the Indian Academy has done in a moment, which has been a major source of that e-learning hub. Near finally, we are preparing a global neurological core curriculum as an ongoing major WFN initiative to standardize neurological training to address the minimal required knowledge, clinical skills, and competencies of neurologists, recognizing regional variations in resources, funding, and diseases. Now, training of non-neurologists is important. It's critical because neurologists can't do it all. And it's important that we train the doctors and other healthcare professionals who are non-neurologists to diagnose and treat neurological diseases. Many of our activities are open to non-neurologists, including, of course, the e-learning hub and the Sub-Saharan Africa teaching course, which is sponsored by the EAN, the WFN-IAN, and others. And there are non-neurologists who participate. And importantly, the neurologists that we train are also important trainers of primary care providers. And last but not least, the Indian Academy of Neurology has really been a pioneer of the use of online education to promote the education of non-neurologists, neurologists, and the public, frankly, as you've seen throughout this morning. And I want to just congratulate the Indian Academy of Neurology, Dr. Meshram, Dr. Singh, Dr. Surya, and all of the rest of the dignitaries of the IAN for really pioneering and teaching us all how to use Zoom as we are today to educate the world on neurological diseases. And that's the end of my talk. And thank you again for inviting me.
Yeah, thank you, Steve. It was wonderful, and it was great to know that what WFN is really doing and extending a helping hand to the needy residents and doctors in the region, and the WFN is at the same time, involving the lay people for education, and that was just wonderful. And it was said that education is the most important aspect of the healthy brain, and the best investment. It is said that you invest in education in children. So thank you very much, Steve. Now we move on to Professor David Docking. David is the headache specialist. He's a co-chair of World Brain Day. And I requested David to speak about headache and brain health. David, please.
Good day. Can you hear me, Professor Meshram?
Yes, we can hear you.
Thank you so much for having me. It's a pleasure and an honor. I must applaud and congratulate the tremendous leadership of the Indian Academy of Neurology over this recent past in helping to promote brain health, and in your support and partnership of the World Federation of Neurology's World Brain Day. So thank you very much. It's been a privilege and a pleasure to be working with Dr. Vijayarapni and Dr. Griswold on this World Brain Day. Thank you for asking me to speak about migraine, a topic that's near and dear to my heart. You've heard already from Professor Carroll how disabling migraine is. It's second in terms of disability adjusted life years among all neurological disorders. So I'll say a few comments about migraine. First of all, it's the most common neurological disorder in the world. It affects 1 billion people. In fact, almost 83 million people are having a migraine attack somewhere in the world today. It's the #1 reason for neurological consultation. So as neurologists, we have to be interested in migraine and other headache disorders. And it's the second most disabling neurological disorder in terms of years lived with disability, but it's #1 among those between the ages of 18 to 50 because of the demographic that's mostly affected by migraine. And that happens to be a time when people are building families, they're going to school, getting an education, they're building careers. So it's a time of peak productivity. So the societal and the personal impact and burden of this disease is tremendous on working people and on working families. Migraine is a brain disorder. It's not just a headache. It's an inherited neurological disorder, in fact, that yes, it's characterized by head pain, but it's also characterized by a number of different neurological symptoms, be they speech, motor, cognitive, language, sensory, vestibular, as well as autonomic symptoms, changes in heart rate, blood pressure, gastrointestinal symptoms. So it affects the whole body, and it affects the whole person. And I think those are two important takeaway messages. It's not just a temporary disruptive headache. Many people believe that the causes of their migraine are stress, or it's the caffeine that they drink, or it's too much chocolate, or it's they didn't get a good night's sleep. But it's important, I think, to distinguish between what causes migraine and what triggers or influences migraine. So a number of different genetic studies now have demonstrated that there are at least 123 genetic loci, 123 genetic loci that's been associated with migraine that increase the risk of migraine. And depending on how many of those an individual has, how many of those loci, that will predict, in terms of the polygenic risk score, whether they have a family history, the age of onset, and the severity of the disease. So as we all know, there are some people who have migraine that may only have a half a dozen or a dozen attacks in their life. And then there are some people with migraine who have attacks every single day. That's most of the people that I see in practice. And that largely is based on the genetic load and the number of variants that they inherit. We're starting to understand now better what those genes code for. And when we understand that, we'll be able to develop disease-specific therapies. And actually, it will usher in a new era of precision medicine when we can identify which patient is going to respond to which treatment. Now, there are a number of triggers, like most polygenic diseases, whether it's asthma or diabetes or hypertension, there are environmental influences. And you can see some of those environmental influences on the right. There's a myriad of them. And some people are affected by some of them, some people by none of them, and some people seem to be affected by all of them. So it's important as clinicians that we identify those things in a person's lifestyle that we can modify that might reduce the burden of illness in an individual patient. As I said, migraine frequency is highly variable. And what I'm showing you here is on a population level, the proportion of people who have what we call episodic migraine. That is 15 or fewer than 15 headache days per month versus chronic migraine, which is 15 or more headache days per month. And you can see that a not inconsequential proportion of the population have chronic migraine. And indeed, a number of us have recently shown that people who have more than 8 days of headache per month who have migraine appear to be equally as burdened as those who have 15, 20, or 25 headache days per month. So you can see here that about a third of the population actually are significantly impacted by this disease. And we've identified now in population studies a number of risk factors that help us as clinicians identify which patients are likely to progress to a more chronic and more disabling form of the disease. I listed some of these here: depression, obesity, the excessive use of acute over-the-counter or prescription medications, snoring or obstructive sleep apnea, inadequate treatment. So a patient who's inadequately treated, either from an acute or from a preventive standpoint, are more likely to progress, caffeine overuse, and there are others. So I think it's incumbent upon us as a neurological community to begin to identify these people earlier in our practice when they're down here in this frequency area, before they progress, identify the risk factors and manage those risk factors aggressively. Now, if migraine isn't disabling enough, it's associated with a myriad, a plethora of other comorbid diseases that occur more commonly in people with migraine than in people who don't have migraine. And I've listed some of the different categories here: respiratory, cardiovascular diseases, GI diseases, psychiatric disorders, musculoskeletal disorders, and other neurological disorders. And each of these comorbidity classes were associated with a significant risk of progression to chronic migraine. So when the implication for us as clinicians is that when we identify a patient in practice, we look for risk factors and we look for comorbid diseases that may be associated with progression. And those are the people who we should be more aggressive with and intervening earlier in. Now, the United States is a resource-rich country. Despite that, only about a third of patients with migraine actually consult a healthcare practitioner in the United States. And in low and middle income countries, I know that that has to be worse. For those who do consult, with episodic migraine, a quarter are misdiagnosed, and for those with chronic migraine, 2/3 are misdiagnosed. So less than a third consult, and for those most disabled on the chronic migraine spectrum, almost 3/4 of the patients don't even get a diagnosis despite the fact that they consult. So we've got a long way to go in terms of access, getting the word out that there's a lot that can be done for these patients, and educating the healthcare workforce on how to render an accurate diagnosis. You would think with a centuries-old, a millennia-old disorder that's very simple to diagnose in clinical practice that we would have gotten this right, but we haven't. Despite that, and despite the smallness of this scientific community, we've made great strides in our understanding of the anatomy, the biology, and the mechanisms involved in migraine pathophysiology. And it's based on that better understanding of mechanisms and identification at the cellular and at the molecular level. The things that are the peptides, for example, and the neurotransmitters that are involved in migraine, identifying those have teed up targets, new targets for treatment. And, I'm delighted that as someone who spent 25 years in this field, it's been a desert, frankly, over the last 20 years in terms of new treatments. But over the past 3 years, there have been 8 new medications that have emerged. 8 medications in 3 years. That's never happened in this field for the treatment of migraine, based on that better understanding at the molecular level of the pathophysiology of migraine. As Dr. Vijayarapni said, there's so much we can do for this patient population. And it really takes an organized, a proactive, a multi-component, and a patient-centered approach to the management of these patients, particularly those that by the time they make it to the neurologist or the headache specialist's office are quite impaired and disabled. And so I've listed some of these on the right. I've talked about risk factor modification and lifestyle factors like diet, exercise, and sleep. And I should say that there are diets now and exercise programs that have been shown in randomized controlled studies to be as effective as the medications that we use. So implementing these, I think, is important because it's also important in reducing some of the risk factors that I talked about, such as obesity and hypertension. There are biofeedback, mindfulness, cognitive behavioral therapies, nutraceutical and neurostimulation therapies, pharmacological therapies, both oral and injectable biologics, injectable therapies. All of this, when brought to bear on a single patient, make no mistake, we can make a huge impact on every patient with migraine, whether they have 2 attacks per month or 30 attacks per month. Today, unfortunately, we get to the patients too late. Patients treat their attacks too late, and patients are not initiated on preventive treatment early enough to make a difference in the course of their illness. So we have to do a much better job in the future of getting to patients early before they progress, and of teaching them how to manage their acute attacks by treating early and not allowing the attack to progress, because once the attack progresses, the suboptimal management of individual attacks is indeed also a risk factor for progression. Today, we manage people with step care. They have to fail multiple medications before they get to some of the newer medications that have emerged. Unfortunately, even in the United States and in European countries, that step care exists where these new medications are available. So it's very challenging for us to get access for our own patients to these new medicines. In fact, I'm holding a roundtable in the very near future with multiple stakeholders to try and improve access. But as many of you have said, most of the world's migraine burden falls upon low and middle income countries where access to healthcare, never mind these new therapies, is simply not available. And that's a tragedy. When we do all of this research, we generate all these new medicines, and yet only a tiny fraction of the patient population has access to them. That is something that we absolutely need to change. So access, I believe, is one of the most important issues facing not only people with migraine, but many neurological diseases. In the future, once we get access, my hope and trust is that we'll know enough about these subgroups of patients, because of course, not everybody with migraine responds to the same medicine. We have to be able to identify an individual patient and predict with a high degree of accuracy which treatment they're going to respond to. So we need in the future more personalized care. Obviously, continued research and a better understanding of disease biology is important because it will lead to an increased interest in migraine. When I was a resident and I was graduating from residency, I was the only one that I knew that was going to specialize in migraine. At the time, it wasn't even really considered a neurological disorder. I think the interest is growing. And I think as we understand the molecular biology of this disease and new treatments come into, emerge, there's no question we've seen almost an explosion of new interest. As we understand the molecular biology and the anatomy of this disease, the stigma will reduce. We'll develop more disease-specific treatments, and we will hopefully improve access and improve the precision with which we can deliver the right treatment for the right patient at the right time. I will close by saying that the World Federation of Neurology, in partnership with the African Academy of Neurology and the International Headache Society and its Global Patient Advocacy Coalition, has for the second year in a row launched a nationwide education program in Africa, which has reached several thousand clinicians in Africa. And I'm optimistic that with more efforts like that from an educational standpoint in countries throughout the world, that we will be able to educate the workforce that's going to be necessary to deliver care to the more than 1 billion people, because there aren't enough neurologists, nor will there be certainly in our lifetime to be able to deliver care to all of these patients who need it and who deserve it. Thank you very much for inviting me, and thank you for the time.
Yeah, thank you, Professor David. It was a wonderful talk, and it came from the expert. And if some of the audience has any questions about to any of the panelists, please post in the Q&A box. And as Professor David has said, that there are 3 important aspects of brain health: diet, exercise, and sleep. And we have an exercise expert in India, Dr. Suryanarayan Sharma, who is a runner himself, and he has formed a runners group in Indian Academy of Neurology. And Suryanarayan Sharma, can you highlight the importance of exercise? Suryanarayan Sharma is a consultant neurologist at Apollo Hospital, Bangalore, and he's also a stroke specialist. Suryanarayan.
Yes, sir. Yeah. Good evening, everybody. Dear, office bearers of World Federation of Neurology, and Professor Nirmal Surya, President, Indian Academy of Neurology, and Dr. Chandrasekhar Meshram, sir, the convener of today's program. At the outset, I thank IAN for giving me this opportunity. So today I would be talking about exercise and brain health. I'm sure all the co-panelists agree that exercise is the most important part of maintaining brain health. Exercise means both physical and also mental exercise, which is sometimes mental exercise in the form of giving calculations, puzzles, and playing chess and other games also has to be highlighted in some of the things. Exercise, as the American Heart Association and American Stroke Association recommends, it should be at least 150 minutes per week. That is around 30 to 40 minutes per day, at least 5 days a week. It should be a moderate to brisk walk or a jog or even a running if you are used to do the running, or even those who cannot run or jog due to physical disability like osteoarthritis or any of the disability, they can actually do yoga or meditation, or even with the help of a trainer they can even use the gym and be fit. So various neurological disorders we always recommend physical exercise. Stroke, it is very helpful in stroke rehabilitation. There are multiple studies which have shown that the stroke rehabilitation, the most important thing is physical exercise and physical activity. Parkinson's disease, dementia, Alzheimer's dementia, and various other neuromuscular disorders also patients benefit with physical exercise. So we, the Indian Academy of Neurology, we have a official runners group. Actually, it's a fitness group of Indian Academy of Neurology. 2000s since last 5 years, we have been promoting, and we have been, most of our colleagues have been the brand ambassadors for fitness for the IAN. Actually, we started with a Run for Brain event, that is a 5 kilometers run event during our annual conference. But it was a small event, but it actually progressed and evolved into a larger movement, I would say. So now we have around 150 neurologists who are part of the group, and they have been doing physical activity almost regularly. Every year we conduct a 1,000 kilometers run challenge for our members. I'm happy to say at least last year we had 40 people who have finished that task. And also to promote the brain health awareness for today's program, actually the IAN runners group is throwing a 2 million steps challenge for its members, the running group members. In 7 days, actually our members, at least most of them do 10,000 steps a day. So we are actually requesting them to join this movement and to promote the brain health awareness. And every member is doing some or the other activity across the country. And yeah, exercise is the most important step in promoting and protecting brain health. So I would stop at it. Thank you very much.
Thank you, Dr. Sharma.
Yes.
Wonderful initiative, and those who can't run, you can walk or you can do the cycling, but the exercise is most important part. And if you do exercise, it's shown that your chances of dementia are 30% less than people who do regular exercise. Thank you so much. And another activity which is very important for brain health is cultivating hobbies and taking interest in different things. And we have Dr. Sumit Singh. So Dr. Sumit is an EC member of Indian Academy of Neurology, and he has interest in music. So how does music help in brain health, Dr. Sumit?
Yeah. Good evening, esteemed members of the World Federation of Neurology and the Indian Academy of Neurology. I was supposed to be in a remote town by 6, but because of very faulty weather, I am on the road. So I'm actually addressing this light crowds on the road. So it's rightly said that if music be the food for love, then one should play on, play on, play on. And it's probably also rightly said that if you want to form up your body, you head to the gym, but if you want to exercise your brain, listen to the music. We at the Indian Academy of Neurology take music rather seriously, and for the last 4 or 5 years, we've been organizing a sort of a singing program to entertain those people who attend the annual conference of the Indian Academy of Neurology. And we're about 20 to 25 of us who perform on the stage, and we try to, sort of show that the neurologists can themselves be entertainers as well as clinicians. Also, this year, what we have done is that we have created a special song for the neurologist by the neurologist, which will be translated into several languages, and it will be played at the Indian Academy of Neurology annual conference. And this musical program, which we call as Neurogama, it is basically the neurological version of Sare Gama Pa, which are the Indian notes for music. So we would be playing that, and those people who are going to attend the annual conference of Indian Academy of Neurology and the IOCN might have the treat and listen to it in different languages. There are very few things which can stimulate the brain like the music does. And if you want to keep your brain engaged throughout the aging process, listening to a playing music might be a great tool. Various studies across the world have found that music does have a very, very good role in reducing the anxiety, bringing down the blood pressure, the pain, and deafness and memory. It's an unusual topic for me in terms of my scientific interests. I am otherwise a headache specialist, but I've been given this task of doing this annual program with the neurologists, and we plan to take it forward this. Dr. Mishram, sir.
Thank you, Sumit. And I can understand that you joined in a very difficult situation, but thank you for joining with us. And we have now Dr. Joy Desai, who is a consultant neurologist at Jaslok Hospital and head of neurology at Jaslok Hospital. And he's a sleep specialist. So what is the importance of sleep and brain health?
Thank you, Dr. Mishram, for asking me to be a part of today's awareness program. My apologies for being in a non-congenial environment, as you can see on the video, because I was deluged with work today and I could not tear away from patient commitments. So I think very simply, if you really want to ask me, the best way to understand sleep is that sleep is a medication. It does everything that a holistic medicine can do. Our human sleep, we have large amount of scientific proof. Our human sleep is vital for memory consolidation. It is very important for making us emotionally stable, especially a phase of sleep called REM sleep. Every night when we sleep and we have that little bit of REM, even if it is 7% of the sleep time, it helps us to become emotionally stronger. And it takes away, it depotentiates the traumatic experiences that we have anytime in our daytimes. It's very important for immune competence because sleep improves something called the natural killer cell replenishment. And therefore, if our sleep is compromised, our immune systems become weak. And very importantly, I think a few years ago, about 2013, we discovered that we have a biological maid in our sleep. What our sleep is doing is that it's actually cleaning the brain of proteins that are potentially harmful to the brain. So there are two proteins that everybody talks about, amyloid and tau. And if they accumulate in a very large amount in the brain, they can be responsible for Alzheimer's disease. And we now know that even in normal people, when we sleep at night, the brain is getting cleaned of amyloid and tau when we have a good night's sleep. And by a good night's sleep, we mean at least 7.5 to 8 hours of sleep in an individual at the right time. And it is the timing which is as important as the duration. Many times patients ask that, is it okay if I sleep 7 hours? But it's also important to sleep at the right time. And the right time is roughly 4 to 4.5 hours from sunset. And to awaken the right time is with sunrise. So if we can manage that, then what we are doing is that we are servicing our brain systems very well. Very few people know that sleep is also relevant for blood pressure regulation, for diabetes, regulation and for regulation of our fatty stores. So for example, if someone is on a diet and is exercising but is not able to lose weight, you have to ask whether they actually are sleeping appropriately. Because when we sleep late or when we sleep less, then there is an imbalance between two peptides, leptin and ghrelin, and they promote fat storage. So essentially, I think sleep is a mega medicine. It's not just dissociating from the active world. And if our brains are to stay healthy, then through life, we need to have good quantity at the right time sleep. And not surprisingly, therefore, in Los Angeles, there was a study that was done called the Rush study about 4 years ago, which was able to show that, which showed very clearly that if in middle life you are sleeping 6 hours or less at an average, then it enhances the risk of dementia as an older person by a good 30 to 40%. And that's a seriously alarming number. So I think if in amongst the different anvils of brain health, sleep plays a very vital role.
Thank you, Joy.
Thank you, Dr. Mishra.
Yeah. I think another aspect is the diet, and then I will talk sometime about the diet, but the three things which are important, that is my area of interest, and three things which are important, that's what to eat, when to eat, and how much to eat. And so that is...
we have always listened very carefully to you when you talk about diet. I think you have very important scientific things to say.
Yeah. And today we are running out of time, but I would like to thank all the participants, Professor WFN President, Professor Wfn Griswold, Professor Bill Carroll, Steve Lewis, Professor Tisa Vijayarapni, Dr. David Dokik, and Dr. Jai Desai, Dr. Surya Narayan Sharma, Dr. Sumit Singh, Dr. Meenakshi Sundaram joined, and Dr. Meenakshi, are you here? And IAN President,
I'm here, sir. I'm here.
Surya,
I'm here.
Dr. Sita Jailakshmi. So I request Dr. Meenakshi Sundaram to propose vote of thanks. And before he joins, I would like to remind about tomorrow's session. And tomorrow we have a session on substance abuse and brain health. And it's a very important session because it's an important social problem. And from WHO, Dr. Catherine Seher will join. She is a mental health and brain health specialist. Dr. Rajinder Dhameja from Delhi is the convener or moderator. Dr. Pratima Murthy, who is the Director and Vice Chancellor of NIMANS, Dr. Amit Chakravarti from Calcutta, and Dr. Sudhir Bhave, who is a psychiatrist from Nagpur. They will join, and we'll have a very important session tomorrow. Over to you, Dr. Meenakshi Sundaram.
Thank you, sir. First of all, thank you, Dr. Meshram, for taking this wonderful initiative and always educating people and including all of us. And this has been like a hectic day. It's like a marriage festival today. They are very, very happy from Indian Academy of Neurology to see the amount of activities that are happening across India on this World Brain Day. I myself, I've been part of at least 7 events from morning. I just came off another event. We had a patient education program now. So it has been a wonderful day, and to cap it, something that's done under the aegis of the Indian Academy with the World Federation pitching in, with all the important people here, Dr. Tisa, Dr. Griswold, everyone. It has been a wonderful initiative, and we sincerely thank each one of the panelists who have been here and who have offered all their expertise. And we look forward to many much more events in the future. Thank you all. Thank you very much.
Thank you, Dr. Meenakshi Sundaram. I think we had a very wonderful session, and we are going to have equally interesting and enjoying sessions over the week. Please log in tomorrow, same time at 6:30 p.m. India time. And daily we have the same session. Dr. Nirmal Surya would like to say something.
Just want to thank everybody for being there. And very important message has been delivered by the expert from the global platform. And this is only been possible through the effort from you. And I'm also thankful that today, on my request, many of EC members has been here. Thank you, Meenakshi, Sita, Sumit, to be here and supporting the campaign. Thank you, everybody.
Thank you. Thank you so much. Thank you, Professor.
Thank you. Thank you. Nice session.
Thank you.
Thank you, sir. Thank you very much.
Thank you, David. It was a wonderful talk. Thank you.
Thank you so much. Thanks for the invitation.
Thank you.
Thank you, Meshram sir. Thank you very much.
Thank you. Thank you. Thank you, Mansi. I think the session went on.
Thank you, sir.
Thank you. Please send the YouTube link.
Sir, I already shared with you.
Okay. Thank you.